Welcome to Pullback, the podcast where we usually challenge ourselves to try something new in ethical consumption. Then we tell you what we learned, fuck-ups and all. I'm Kristen Pugh, and I'm here with Kyla Hewson. And this is a special episode in partnership with the Canadian Philanthropy Partnership Research Network. Today we are joined by Steven Ayer to talk about COVID-19's impacts and the prospects for a just recovery. So Steve is the president of Common Good Strategies. He is also the lead researcher and author of the Toronto Foundation's Vital Signs Report, and most recently, the lead author and researcher of the Fallout Report, which explores the impact of the COVID-19 pandemic in Toronto. I'm wondering if, just to start, can you tell us a little bit about what the Fallout Report is and sort of what it's trying to accomplish?
Absolutely. So Toronto Foundation has been conducting vital signs studies about the health of the city of Toronto since the mid-90s, looking at 10 different issue areas ranging from income and wealth to health, education, transit, all these sorts of critical issues. And we did a special edition after the pandemic that really focused on, across the 10 different issue areas we focus on, how have things changed? We talked to more than 60 leaders, predominantly BIPOC individuals, explaining how their organizations, their communities, their neighbors, and themselves have been affected. And we summarized a combination of economic and social research with these in detailed interviews where we tried to understand, on the ground, what does this look like?
Was there a particular finding that you think sort of struck you the most or was the most surprising to you?
The thing that struck me the most out of the research was something that has gotten a lot of attention, which is the overall inequality of the situation. And it was just how widespread it was. We covered 10 different issue areas. Within that's probably at least 50 or 60 different issues. And almost every single area we found, we could see profound differences based off of income and profound differences based off of racialized status. And while the attention has been greatly on some of the unequal impacts of COVID on racialized communities, particularly around rates of infection. So when we wrote the Fallout Report, we saw about 10 times higher rates of infection amongst the most racialized neighborhoods than the least racialized neighborhoods. We saw about 5 to 6 times higher rates of infections amongst the lowest income neighborhoods versus the highest income neighborhoods. But it was just almost every issue area we looked at, we saw these profound inequalities, whether it was education, and we see the students coming from the lower income neighborhoods were struggling most, whether it was mental health, we see again the folks who are struggling most were those who are racialized and low income, as well as when we look at the unemployment situation, those who are most likely to be laid off, most likely to be struggling to pay their bills. In all cases, we were seeing it was disproportionately racialized and low income parts of the city. And I think that was just the sheer scale across almost every single dimension we looked at. It was the combination of those that really struck me of how challenging this is going to be to have that just recovery.
Yeah, for sure. And I mean, I feel like that's one. So Toronto bills itself as a diverse city, and it is in many ways, but the inequalities are really, really striking in terms of not only the Fallout Report, but poverty in Toronto in general.
We've been writing vital signs for a long time, and our most recent vital signs was called Growing Pains Amid Narrow Gains. And one of the points we really highlighted was just how much inequality had grown. And a lot of the things in the previous last year report, or I guess a year and a half ago now, was about the vulnerability in the city. So a recent study by United Way of Greater Toronto looked at how income had evolved over time. And they found from the 35-year period ending in 2015, racialized folks had seen their income only go up by 1% after adjusting for inflation, while white Toronto residents had seen their income go up by 60%. And we see these sorts of trends show up over and over again. The small, narrow segment of the population has done phenomenally well, and a whole other segment of the population has been left behind. And I think this is what makes these sorts of inequalities you're seeing now so problematic, because the situation had been a situation where people were being left behind. They were struggling with, your income has gone up by 1% after adjusting for inflation, whereas like in the last decade alone, housing prices are going up 4 or 5 times faster than your income. So for folks who are just sort of going through their day-to-day lives, they in many ways feel like they're falling further and further behind. And then you have the pandemic arriving, eliminating many of their jobs, particularly for the most vulnerable workers. So it's really, I think, the challenges that we talked about in our previous reports I think, like, in the things that we were worried about, there are many cases, I think, where we talked about some of the risk if another recession came, but we never could have imagined that, this or anything that's going to come. And I think, like, when we were signaling the warning signs of how vulnerable the city was because of these profound inequalities that have grown over time, I think this is why when you look after study, Toronto is one of the hardest hit places, in Canada and perhaps even like in North America right now because of so much of the vulnerability it had going into this.
Yeah, for sure. And I think what we're going to do with the interview is pull apart some of the different themes from the report. And maybe we'll tease out that notion that Toronto was kind of already at crisis levels on some of these issues when the pandemic started. But let's maybe start by talking about some of the report's key findings on the health and infections themselves. So can you tell me a little bit about the inequities that have happened in terms of who has been infected with COVID-19 and who has died from it? I know you alluded to part of that before.
Yeah, and I think so building on the point I made before, we did see disproportionately it was low-income and racialized communities. These are typically folks who are essential workers, those who have to work in person. Disproportionately, of course, those who can work at home were not the ones being infected. So obviously, I think it's well known at this point that seniors are at great risk, but the intersection of things like low income, pre-existing conditions, some of the sorts of overcrowded housing conditions that many racialized and low-income communities live in Toronto, they all cumulatively add more and more burden and risk. And I think this is why we're seeing such profound differences. I mean, when we talk about 4 up to 10 times higher rates of COVID infection in the most racialized versus least racialized parts of the community, like that's not based on race. It's based off of these decades of growing and systemic issues that have culminated in like all of these risk factors all being pointed in the same direction. I think, they all add up, and that was really a key point. And I think one of the things we really wanted to do with the Fallout report was emphasize that the infections and the deaths are huge. They're, very troubling. But it really is like this has been so all encompassing that like every different aspect of what we cover in, vital signs, the 10 different issue areas, all of the dozens of issues underneath it, every single one is being impacted. And so our focus was definitely we want to start off by explaining the context, but then also really focus on what the ripple effects are, both from like the fear of getting infection, the fear of like, going to work, the mental health consequences of those sorts of things, as well as the direct, consequences of directly getting ill or dying from the disease itself.
Yeah, definitely. I am curious, before we move on to talk about some of those knock-on effects, what are some of your thoughts on what needs to be done, either in the near future or in the long term, to improve the quality of public health and also to improve the equality of access to health supports in Toronto?
Obviously, a whole variety of areas that we cover that I think are critical. You really can't talk about the topic without discussing the inadequate funding of long-term care homes, and I think the challenges that predominantly for-profit long-term care homes have faced in the middle of this. A number of studies looking in Ontario in particular have seen that for-profit long-term care facilities have had much higher death rates and infection rates than non-profit facilities. So I think like there's a number of issues there to unpack, but one of which is there hasn't been enough funding, and then also the structure of how we decide to deliver these critical health services has a profound impact on the outcomes that we have. And then I think on the broader public health space, there's a huge sort of need for understanding the social determinants of health, especially in a city like Toronto, where the housing situation has gone very problematic, and that's affected many folks who are living in overcrowded conditions because they can't afford to live on their own. It's had a whole bunch of situations where people are living sometimes in buildings with poor ventilations, or ones where high rises where there's the great risk of infection, and then a lot of the things around these pre-existing challenges around food insecurity and things like that. And I think it's hard to exactly say what role that some of those things might play in, say, the response to COVID, but studies have shown like Black households, as one example, have 2.8 times higher rates of food insecurity than white households, Indigenous households, similar sorts of things. And when we look at a lot of the communities that are most impacted by some of those public health challenges, they're also the ones that we highlighted are experiencing greatest risks here. So I think like there's so much different factors that go into it that all sort of need some attention.
You mean there's no one Band-Aid solution that would solve all of our problems?
Yeah, it would be a much shorter report.
This report sounds... Okay, so full disclosure, I did not read it. Sorry. But it sounds wild. How long is this report?
It's 120 or so pages. I think I wrote it over a couple months, and I finished it while I was in the hospital with getting a newborn. So,
oh my goodness! Wow, really impressive work. I'm going to have to read it now.
Thank you.
So moving on to the next theme, and I think your comments on the social determinants of health really lead into this well. So the report talks about food insecurity in the context of the pandemic. I'm wondering if you could talk a little bit more about what food insecurity looks like in Toronto and how it's changed over the last 11 months.
A lot of the challenges we talk about growing inequality, we've seen increased challenges around food insecurity for a long while. Like one exemplifying factor we can see is looking at food bank usage. We saw a big spike in food bank usage after the Great Recession, which never declined back to the level it was previous. There's a continual ongoing pattern of increase in food bank usage. What we've seen in the pandemic is an acceleration of that trend in a fashion that no one's ever seen before. Daily Bread Food Bank reported 200% increase in new users. The number of people calling into resources like 211 was about twice as high every single month as it was before the pandemic. And obviously those organizations are not equipped to be able to respond. And we talked to a number of the leaders in the organizations that work in those spaces, and it was really critical. Like folks like Paul Taylor from Food Share Toronto obviously recognized the need for emergency support, the need for organizations like theirs to have funding to be able to provide people food support. But they really were prioritizing and emphasizing that what we should be talking about in our report was the system that causes such high rates of food insecurity, and opposed to the actual rates of food insecurity itself. And there's a very, the food banks have played a very important stopgap in the pandemic, but it's income supports and systems that provided a safety net that are most critical. And that's the theme that we heard over and over again when we were talking to the leaders of these organizations, was food insecurity is an income problem. It's not a food problem. And the other thing I think it was particularly concerning, especially as we go through now, we're full sort of, fortunately, hopefully we continue to see improvements in the current situation. But as government funding that's been put in place to be able to provide financial supports runs out, like the organizations that were working on food security and the emergency food relief efforts, they were very stretched. They did get some initial funding and did get a variety of funding from the federal government and provincial governments and municipal governments. But it wasn't enough compared to the sheer and utter scale of which their demand changed. And they are, of course, continuing to provide critical stopgaps. But I do think, on the resource side, like when we surveyed folks who provided food, everyone said they were not prepared for a second wave. So I'm sure many of them had financial reserves that are completely tapped out now. So even if things do continue to improve, the organizations themselves, many of them are in a very financially vulnerable position right now. And, even if things improve dramatically and we see employment rates start to go up in the spring, et cetera, a lot of them need to rebuild these financial reserves if they want to be viable, long-term, successful organizations.
Yeah. So these food banks are experiencing much higher demand, and at the same time, they don't have the resources that they need to keep up with it.
Yeah, absolutely. And I think one of the things that's really critical when we talk about the nonprofit sector in general is it's a very strange industry in the sense that what other industry do you see huge increases in demand at the same time as your revenue plummets? So a lot of these food banks were seeing their fundraisers canceled, their social enterprises shuttered. They may have been provided a variety of meals and food delivery options that they charge fees for to subsidize their core operations. They had gigantic fundraisers that often had great support, and all these were canceled at the same time as they had their biggest drop in revenue ever. And this is a problem across almost every sort of social service delivery organization we work with. All of them saw demand increase, and many of them, not all, many of them did see their revenue decline at the same time. So for those who are trying to respond to these challenges that are emerging, It's a completely unprecedented situation, and I don't think you can find many examples of industries outside of the nonprofit and social sector that have faced this experience of, oh, my revenue's gone down more than ever, and twice as many people are trying to get my services.
Yeah, it does seem to be a uniquely nonprofit issue. And actually, I think that bridges well into the mental health impacts too, because it seems like there's a similar story there. So I guess I'll maybe step back a bit and ask you if you could explain how the pandemic has affected mental health in the city.
Yeah, I mean, I think at this point, anyone who has not at some point in the pandemic had some mental health consequences, I'm quite curious what they do with their lives, how they spend their time. I think all of us probably have something to learn. But what we really see is that the mental health consequences of the pandemic are substantial and growing. When we look at the Fallout report, it was interesting to see, like, when we had data, for example, from Ontario 211. They saw going into the fall where we sort of have that risk of a second wave is actually where they saw a lot more sort of people calling in for sort of support around addiction, support around, crisis management and these sorts of things. So that initial 6-month period, I think, was a lot of strain. There was depression, there was anxiety, there was fear and isolation. But like the longer it went on, the more it actually triggered some of the most vulnerable and marginalized communities to actually have, the crisis response. And the studies that I've looked at this more recently have just suggested, like, the depression and anxiety consequences of these things didn't go down at all through the winter. In fact, and it looks like, some of the more recent surveys suggest like things are as bad or worse than, in the initial waves of the pandemic.
Yeah, I mean, definitely I've seen people talking about the pandemic wall that everybody's hitting now. So I'm curious, what are mental health organizations saying needs to be done either in the near future or in the long run to sort of address these mental health issues and the ramifications of dealing with them after the pandemic is done,
We talked to we've talked to quite a few different organizations, and I wouldn't say there was a single sort of area we saw folks wanted to really highlight. I mean, I think, when we talk to these sort of crisis lines, there's obviously the need for trying, the resources to be able to respond effectively. But like a lot of the issues that we previously talked about in Vital Signs also speak to the real risk here, which is, so Children's Mental Health Ontario, for example, has been speaking about how there's an 18-month wait list for the most intensive counseling for children. For a lot of children, the struggle and that they've been going through now are on a completely different scale than they've seen before. And going into this situation with these broken systems really exacerbates the problem, because there wasn't enough resources to respond to a lot of these needs before the pandemic, which speaks to, the holistic nature of it. And it's sort of mental health has become something that every organization in the nonprofit sector, whether it thought it was an arts organization or a youth organization or all of them now have to think about mental health as part of their strategy. And I think that's the key thing is, if you work with people, you need to think about their mental health right now. Because if you're trying to educate someone and you're not thinking about their mental health, you're probably not going to be doing the best job you can. And in the initial stage of the pandemic, we talked to like education organizations that repurposed their entire budget to focus on food security issues. Just like Success Beyond Limits was one that we talked to. That's a Toronto-based organization that during the summer reprioritized their budget to focus on food security. And I think going forward now, that ongoing mental health piece is going to be part of everyone's work for, honestly, a long time. When we looked at previous studies of like that initial trigger of mental health, like it often does long lasting. So I think it's going to have to be something that every organization is building into its long-term strategy, even if they weren't doing it beforehand. And I think the other piece that's really critical to note is when we were looking at this based off of income, there was profound differences in mental health challenges based on how difficult it was to pay your bills. If you're worried on top of everything else, how am I going to pay my rent? How am I going to buy food? You're obviously in a much more challenging state. And that's one thing that I think is really important as well in the mental health field, is looking at that system that really, in some cases, people fell through the gaps. And how do you ensure that going forward, people who may have now had to take out loans, people who borrowed money from their friends, tapped into all their reserves, may still be struggling to pay their rent. And they're seeing, how long will I be covered on EI with the new systems? so thinking more about how to continue to support the mental health of people who are in these really dire situations, sometimes trying to juggle the increased debt they've added because of this. And in past, sort of after the Great Recession, we saw, for example, evictions continue to increase until about 2013 in Toronto, which is people deplete their financial reserves and puts them at risk for a whole array of other problems in the future. And so I think, if you look 4 years from now, 5 years from now, it wouldn't shock me at all if we continue to see homelessness go up, we continue to see mental health challenges and emergency room visits and all these sorts of things continue to go on. Any organization in the philanthropic community, any philanthropist, you need to be thinking 5-6 years from now is these problems need long-term solutions, not short-term solutions. They obviously need a little bit of a temporary buffer, but every organization has to be building in some of these things for the long term because, that idea of depleting your financial resources to respond to immediate pandemic financial challenges, I would think will magnify the vulnerability for years to come.
Yeah, absolutely. I suppose on a different theme within that, because mental health challenges can often exacerbate family issues, I do want to ask about the impact on domestic violence. How has the pandemic affected that?
Yeah, this is another area that unfortunately, of course, we saw huge increases in domestic violence. So it was really hard when we were putting the report together to find, systemic data. But one particularly worrying sign was looking at the Assaulted Women's Helpline. They reported about a 75% increase in calls, and predominantly around domestic violence. And it was very clear very early on in this, there was challenges. I don't know what the more recent data has looked at, but given that we look at some of the mental health things, challenges that we previously talked about that continue to rise into the winter, it would very much surprise me if we didn't also see domestic violence, including, I think I saw a study recently, which I hadn't really read in detail, but talked about how more children are going to the ER with head trauma. And, I think these are some of the consequences in addition to the obvious. And then I think really speaking about the domestic violence situation without speaking to the housing problems in Toronto is kind of impossible. So we spent a lot of time connecting with North York Women's Shelter. Mohini Dada-Ray, who's the executive director there, really emphasized that even at the best of times before COVID, most women going into a domestic violence shelter were turned away because there wasn't enough spaces. And that's a problem just in general with the shelter system in Toronto, but it's a problem more broadly with the violence against women's shelter system. There wasn't any spaces. So if you're trying to flee violence and you go to the shelter and there's no spaces, it's obviously problematic. And with the number of folks who've been struggling to pay rent, that system is just utterly at its max. And I think people are more reticent to, say, go couch surf or other sorts of solutions. So a lot of people are kept in these situations for longer because there's no real easy option to be able to leave that situation now compared to previous. So obviously there has been some resources from the federal government allocated to the domestic violence in the shelter system and all these sorts of things. But it's one of those things, like the shelter system in Toronto is typically operating at 98-99% capacity, where the city of Toronto said it shouldn't operate above 90% capacity, which it was never at the target. And this is again the problem when you build a system with no flex in it. Even a small recession, I think, could have caused some real problems to these systems, and now obviously the challenges are even bigger.
Yeah, for sure. Just one of many examples of how we're sort of already at crisis levels for a lot of issues in the city, and the pandemic just pushed everything over the edge. Let's talk about the economic impacts of the pandemic, though. So I'm interested to hear sort of what are the economic impacts overall, as well as who's been the most affected and how have they been affected the most.
So high level, the economic impacts in Toronto and Canada are not great. We saw immediate increases in unemployments that are completely unprecedented. Things have started to improve in a lot of different factors. But when we look at Toronto right now, Toronto went from having a relatively decent unemployment rate to having one of the highest unemployment rates in the entire country, up there with Calgary and Edmonton. And, month to month, you might have a bit of variance of which one of is the worst. But clearly the city of Toronto bore a huge brunt of that. And one of the things that we talk about in the report was how across the entire country, we saw that low-income workers bore the brunt of the financial impact. So they were most likely to be laid off, most likely to lose their hours, whereas higher wage workers were more likely to actually have seen their hours increase, sometimes through overtime, sometimes not necessarily, we don't know like which of those hours are compensated and stuff like that. Some folks might have gotten raises in order to, because they're being expected to work in more dangerous conditions, all sorts of stuff, things like that. That was a countrywide pattern. And in Toronto, when we look at the top end, we saw much higher rates of increase in hours than the rest of the country. And when we look at the bottom end of the lowest wage workers, we saw a much bigger decrease in hours. When we look at the most recent data here as well, looking at post-lockdown, the low wage workers, again, have borne the brunt of as shutdowns happened again. They're the ones who are seeing their jobs eliminated. And there's going to be some significant consequences as this goes on longer. I mean, it's hard to tell. Historically, studies looking at long-term unemployment have suggested that folks who are unemployed for longer than 6 months have a lot more challenges and difficulties. And so many folks are now in that bucket. I think, it's more than 1 million folks Canada-wide who are sort of in that longer-term unemployment numbers as we're getting into that. And it's really hard to tell whether they're going to share the same burdens that long-term unemployment normally faces. But it's definitely going to be a challenging situation. And then, when we look at, I think, again, speaking to the inequalities, 23% of white Canadians, when we were looking at our data, reported they had some sort of difficulty paying their major bills, and it was 44% of Arab Canadians and 39% of Black Canadians. So I think it really does show the differences. And then when you get into the unemployment rate as well, a third of Black youth in Canada were unemployed. I mean, these sorts of rates are, stunning and unprecedented. I guess you use those words a lot talking about the pandemic, but it's kind of ridiculous. 1 in 3 unemployment is very challenging. That has improved, but it's an issue that is going to have long-term consequences for youth who've gone through it.
Yeah, and I think the report talked about how people with disabilities have also been disproportionately impacted. I wonder if you could talk about that a little bit more?
Yeah, that was a topic that, just in general, I think Canada needs to do a much better job at collecting information on folks with disabilities, including their employment status, their just in general. The studies that haven't looked at it show much higher rates of poverty, much higher rates of mental distress. And, when we look at a lot of the challenges around, we look at disability, both physical and mental disabilities, and they have different consequences. But there's that huge combination with the isolation for a lot of older seniors who are stuck in their homes and weren't able to, they continue to struggle to access things. And, if you can afford to use Instacart or other sorts of things, they can mitigate it. Whereas some of the folks who can't afford to that, or, we're really, reliant on shopping sales, these sorts of things, that's a particular challenge. All of which is to say, we definitely saw the studies we were able to find suggested there was a much greater impact on those with disabilities, whether it was people who were struggling to pay, additional medical expenses and, all those sorts of things. But I think it's an area that, we've talked about a number of reports. We need better data because across outcomes, folks with disabilities have real profound challenges. And I think, the more data sources we can have to highlight how profound those are, the more we can continue to emphasize some real action needs to be done. And again, I think going into this, the Canadian Emergency Response Benefit was $2,000 a month. If you're on ODSP, it's about I'm not going to say it's about $1,100 to $1,200 a month you get per month. When we responded to the pandemic saying, oh, you need at least $2,000 a month to be able to live, realize that the vast majority of folks who are on disabilities and unable to work are living on a fraction of that. And if you look at a city like Toronto, good luck.
Yeah, and just for listeners that don't know what ODSP is, it's the disabilities assistance from the provincial government of Ontario. But yeah, as you're pointing out, it's much lower than what the emergency response benefit has been Canada-wide. I'm curious, what has been the impact of the CERB and the Canada Recovery Benefit, which replaced it. And also, what do you think is sort of the future outlook for programs like this? Do you think that it should eventually lead to something like a universal basic income?
Yeah, I think it's pretty undeniable that the CARB and its replacement and the transition to EI provided an absolutely critical safety net. If we hadn't done it, a lot of these issues we talked about, I mean, they're pretty substantial now. I mean, they're almost incomprehensible what would have happened if the government hadn't stepped in with these sorts of programs. I mean, the ripple effects to the economy would have been, I mean, beyond sort of, again, beyond comprehension. So it was absolutely critical they did that. And, obviously a huge amount of money has been spent on that. So it has drastically reduced food insecurity. It has, improved people's mental health. It has had, a lot of these things. If they not for that, it would have been an utter disaster. So I think, government should be applauded for what it did of stepping in very early and trying to put a substantial amount of support behind that. I think, it's a very challenging sort of thing for the government to try and balance, these hundreds of billions of dollars of deficit with trying to make these policies as inclusive and effective as possible. I mean, if at this point, there's probably a variety of things they could do to, streamline and improve the programs that we haven't necessarily seen. You see a number of economists and social researchers have pointed out, whether it's, conditions that are letting certain folks slip through and all these sorts of things. So there's definitely some challenges with the program. At the same time as if it hadn't existed and it didn't continue to exist in the current form, there'd be millions and millions of Canadians that would have suffered from unprecedented financial distress.
Oh, including yours truly.
That was actually something that struck me as I was reading your report, because the report was written while there was some uncertainty about whether a program like CERB would continue. So I thought that was interesting. I'm curious, maybe we can move on to housing now. I mean, if we're talking about things in Toronto that were already at crisis levels, maybe housing is the most stark. But could you talk about how the pandemic has affected access to housing in the city?
Yeah, absolutely. I did want to actually cover on the previous topic, the one thing you did ask about, the long-term implications, which, I mean, a lot of the folks we talked to were talking about longer-term solutions for some of these problems. A number of folks talked about the need for basic income. A number of folks talked about, the idea of human rights as a framework for everything ranging from housing to food security, all these other sorts of pieces. And there were a lot of policy suggestions talked about in the report itself. I think the most clear point that we can say from it is that, people were struggling on $2,000 a month. And ODSP, Ontario Disability Support Program, Ontario Works are a fraction of it. And that's a huge number of Canadians who are trying to get by on money that's completely inadequate, especially in major cities like Toronto, where, rent is dramatic. I mean, in the past, you might have gotten more support through living in subsidized housing and things like that. But as those options have declined and as a viable opportunity because there isn't enough of it, it's absolutely clear that those programs are inadequate to ensure that people remain, eating healthy food and all these sorts of things. And the studies that I've looked at it have shown that the consequences of people, cutting their food budget, not eating vegetables, all these sorts of things that come often from it. Because we have a public healthcare system, the costs don't make any sense. People are using these systems more and they're struggling because, it's not like there's a huge saving for keeping these things so low, because they often lead to long-term disabilities and all sorts of other things that, mean that they're going to be taxing the healthcare system. So, the most clear thing that's just shown was that the existing support systems don't make as much sense as we might like. And, we've kind of ignored some of that for a very long time. And, those things have been lagging inflation for decades. So every year, it just means people get further and further behind. We need to rely on them.
For sure, yeah. So I'm wondering if you could talk a little bit about how have housing prices changed since the pandemic began, and is housing security Like, is it worse than it was before? Is it about the same?
The housing situation is a fascinating piece because the rental market and the ownership market are going in fundamentally different directions. And part of this is when we go back to those sorts of inequities is one of the studies we point to in the report is how renters have had their hours decreased twice as much as homeowners. So we start off in a situation of those who are renting are in a very, very different financial situation typically than those who own their own home. I mean, we see that, in a lot of jurisdictions and across the country, but particularly in southern Ontario, we're seeing 25, 30% year over year increases in detached housing prices at the same time as like the most recent sort of numbers suggest like a 27% decrease in average rent downtown or something in that ballpark. So you have one going down 25% and another going up by 25, 30%. We've never seen such a huge separation of those two factors. What the implications, I think, of that is that a lot of folks on renting are in real and profound financial distress, and it's really unclear to me what the end state will be if evictions start to go at what they could end up being. So the Canadian Mortgage and Housing Corporation estimated, I think it was 11% of rental households in Toronto are in arrears. So I mean, when you look at that, it's hundreds of thousands of people who are behind on the rent. I mean, often it's not necessarily a huge amount they're behind on the rent, so there's some opportunity to make that back up, especially hopefully when the employment starts to tick up. But like the shelter system has less than 10,000 beds. Even if a tiny, tiny fraction of those folks who aren't paying their rent end up evicted and homeless, like that is a system that can't cope with it. So I think there's some real risk there. And the other piece is I think for a lot of folks, particularly younger folks who don't own homes, looking to see not even this can bring down the price of housing is probably a terrifying sort of realization that again, you have to look at the price of housing in Toronto since 2008. I think it's up by 150%, and whereas your income's up by 30%. I mean, for younger Canadians and Ontarians and Toronto residents, I think there's a profound stress that comes with realizing if your dream was owning a home and you're sort of locked out, that's a particularly problematic. And it also speaks to a much bigger system of, Canadians by and large, the way they plan for retirement is home ownership. And, the accruing of housing wealth has been the primary, retirement plan of a huge number of Canadians. So if the current generation is locked out of that, and we have eliminated, jobs with retirement plans, I mean, obviously that's a very long-term consequence. But I think if we aren't starting to think about how to have a system that can help folks accrue savings for retirement, or now, if you're going to rely on people to save for their own retirement, we need to do that now because it's not going to be for a lot of folks housing wealth.
Yeah, and in particular because the job market is so bleak, especially for young Canadians right now. Yeah, so I mean, we touched a little bit on the topic of evictions, but I'm wondering if we could drill in on homelessness a little bit. Can you talk about what the pandemic has done to the state of homelessness in Toronto?
Yeah, and this was one that was an interesting piece. There's a whole bunch of different dimensions to that. I mean, and when we were studying it, one of the big issues at the time was homelessness encampments. And I think, what happened to a lot of folks over the winter was the sort of when it got too cold for those homelessness encampments, which definitely numbers were suggesting were growing very rapidly, is a big unknown. I haven't seen anything that sort of addressed how people coped with that. But definitely the shelter system was hit its max capacity, and we saw a lot of overflow into encampments. We spent a huge amount of money trying to make homeless shelters safer for the folks who are actually in them, because obviously as a congregate living environment, there's a lot of risk as well for COVID. So, and there's a variety of interesting initiatives that I think folks have been trying to get going for a long time, or in like modular shelter units that can be built a lot faster. And, I think the scale of them may not be necessarily what everyone would like to grow, but, some of these things have actually made some real progress where, some of the advocates have been working on them for a decade and are finally starting to see some built. And I think, with there hasn't yet been a huge increase in evictions compared to what we could see coming up. The number of people who, are behind in rent, if they folks start actually moving forward en masse with evictions, I think that could be where things start to become very challenging. And I don't think most landlords, especially the large landlords, really want the publicity of trying to evict a large number of people in the middle of winter. Into the spring, I could see a bit more sort of consideration on their end of whether it makes sense or not. The other piece now, I think that is an interesting challenge with it is people can make agreements to repay the rent they've missed. So if people are missing their rent, the landlords do have a built-in incentive to try and want to recuperate that rent. Whereas, when we talk about the average rent in like downtown Toronto declining by double-digit percentage, people may not necessarily be wanting to evict folks when, the person coming in might be paying a much lower rent, depending on how long maybe units have been under rent control and other factors like that. So there is a couple things that sort of prevent it from being a huge incentive for folks to be doing evictions at the scale of which they could. And, maybe once students come back or things like that, there might be some of the folks who are not able to make their back payments might be at more risk. And the other point we talk about in one of the reports we wrote was the typical Canadian household saves less than $1,000 per year. That's a little bit confused because some of those folks are drawing down savings because they're retirees. And so it's hard to say what exactly, the appropriate sort of range is. But when you say the average rent in Toronto for a new unit, it might be $1,800-$1,900. And, if you're saving less than $1,000 a year, if you miss one rent payment, that's more than you're expected to save an entire year. So it will be challenging for some folks to make that up. And I think the longer they have to make those repayments, the better off and more likely they are to do it if they, even if, there's a lot of debate of whether, how to go about doing, whether they need repayments or not and all that sort of stuff. But any sort of system that doesn't give people as long as possible to make up those written repayments if they're required will, I think, not really be advantageous for anyone.
Yeah, and I imagine there must be some difficulty. I read somewhere that in Toronto, something like 20% of people are paying 50% or more of their income on housing. So I can only imagine somebody who's had their income decrease because of the pandemic is going to have a tough time paying back the arrears that they've accumulated over this year. So could be a big problem.
Yeah. And I one of the things we often see as well is a lot of the sort of look studies about rent. It's critical to distinguish, I think, between every unit in the market and looking particularly at say relatively recent immigrants or younger folks, because a lot of units have been in rent control for a very long time. So when you average all these sorts of things out together, sometimes the stats on how many people are in quote unquote unaffordable housing is sort of hides the fact that almost every person who's gotten a housing unit in the last 5 years, who has reasonably, even if middle income in Toronto, is probably in unaffordable housing. And, the stats kind of when you aggregate all the buckets together with some folks who might have been in a rent controlled unit for 40, 50 years, they can hide that just the profound challenges that immigrants and younger Canadians who might be moving out of their home for the first time might actually be experiencing. Or, someone who, just had a kid and wants to move to a bigger space. And,
Yeah, absolutely. Yeah, it's, it will be interesting to see what happens with housing in the future. Let's maybe go to the topic of the nonprofit sector. So your report discusses how the pandemic has impacted nonprofits in Toronto. I'm wondering if you could talk a little bit more about that.
Yeah, and really, I hate to use the word unprecedented, but the word, I think, unprecedented challenges is again, an appropriate phrase of that challenge of increased demand for a lot of social service organizations. And I think like social services ranges from, if you have folks who used to run recreation programs for youth are like desperately trying to figure out how to keep in touch with them, how to provide, ensure their mental health is working, how to, support education where appropriate. They're all having these sorts of real challenges where the revenue streams have really shrunk. So like the number of organizations that are saying that they're having revenue decline are huge. When we look nationally, Imagine Canada did an interesting study early on in the pandemic showing that like the average revenue decline across all the organizations early on was 30%, whereas like in the previous like Great Recession, we saw like a 1% decrease in revenue or something in that ballpark. And when we looked at Toronto organizations, I think, like all of the other challenges we're seeing in Toronto, like they're particularly hit by the high demand and particularly at risk of declining revenue because like a lot of them had social enterprises, whether it was, a theater that sells tickets or, a YMCA that sells health and fitness memberships or childcare or camps or, you can sort of keep listing on and on and on, but all these revenues are gone. And a lot of times they're trying to help as many folks as possible in that environment. And we saw particularly small organizations reported a huge risk. So organizations with less than $500,000 in annual revenue, about a quarter of them were saying that they're at high risk of permanent closure. A lot of them said that they've already closed the program or location permanently. A lot of those organizations are grassroots organizations. They're community-led organizations. They're the ones that have the strongest connection to the community. They're often working, directly with in some of the most marginalized communities in, the city or in the country. And I think like the challenges they're facing, it could be, if you actually, we lose a substantial chunk of it, like the representation and the voices of those communities will likewise be being lost. And the largest organizations, like they did say, like, it's not a great financial situation, but very few of like the big organizations said they're going to go under. A lot of them said like they had to lay people off, they had to close the program. You see sometimes some of the folks who've been around for a long time sold some real estate and things like that. And it's obviously great to be an organization that has that flexibility, but these small organizations often, the people that they serve are the ones that have lost their jobs. So no one's donating. The people they serve are the ones who can't, are struggling to eat. So they're desperately trying to find any food they possibly can to continue to provide for folks. And so I think like losing those sorts of organizations, it's kind of challenging because a lot of the organizations are ones that people haven't heard of. So it's kind of hard for folks to sort of appreciate it the same way if, as an organization that you have heard of is going under. But like a lot of them are incredibly impactful and important to the folks in their local communities. And, if funders, philanthropists, et cetera, aren't doing what they can to keep those organizations alive, like we will lose something important that, it might take years and years and years to actually get back.
Yeah. And I'm wondering, so once the pandemic eventually ends, which seems like a long time from now, but like looking 5 to 10 years out, how do you think the nonprofit sector in Toronto is going to look different because of the pandemic?
Yeah, and it's one of those things like it's difficult to prognosticate on what's going to happen. And I would say like for organizations that are looking at their strategy, everyone should be looking at a scenario analysis type approach of there's a few conditions that they could happen or they couldn't happen, and they all are going to have profound implications. So if the variants of COVID are something pops up that isn't covered well by vaccines, and then you have all sorts of ongoing challenges that might be much lower in magnitude, but potentially going on for who knows how much longer, or looking at other scenarios of what if people come back in droves to culture, youth programs and arts culture and et cetera. And like, there's a huge increase in demand. Like, so how do you look at that? And then obviously for a lot of these organizations, the major source of funding for nonprofits and charities in Canada is the government, provincial government, by far the largest. The federal government and municipal government provide very important funds for local organizations as well. But, by and large, provincial government is the big one. And when we look at, the feds having hundreds of billions of dollars of deficits, the province is having tens of billions, in the city of Toronto and like 1.8 billion or whatever is the most recent number. Like the nonprofit sector, if the government enters austerity policies, what it will look like will be fundamentally different depending on what the government does. And it's absolutely critical for their philanthropists to sort of support innovation and funders to sort of do what they can to get resources to keep organizations healthy and strong and all those sorts of pieces. But there's nothing that would affect things more than how the government chooses to respond in the coming years. And I think that's a big scenario. And I think, for a long time, and a lot of us have been recommending folks like, building social enterprises, building alternative revenue streams. And that advice didn't work out so well right now. So, and I think a lot of the organizations that have been, devastated are those that run social enterprises. So, that's maybe if there's government cutbacks, what's needed. So how do you actually build the capacity to have those organizations come back thriving, and opposed to maybe not reopening ever? And, what the nonprofit sector under these different scenarios could be very different. But I think, when we look at the generalization, like I would be shocked if so many of the organizations we spoke to said that technology is going to be a permanent part of how they operate. Like they've learned new things, and they might be offering hybrid models of having both in-person and virtual sorts of events. But I think, while everyone said they want to go back to in person as soon as they can, I think everyone realized that virtual is going to be fundamentally part of what the nonprofit sector needs to do. And the other piece, I think, so many large national nonprofits are located in Toronto and Ottawa, and, they hire, recent graduates and pay them wages where you can't afford an apartment in Toronto. So, and then, they're shocked when a couple of years later people quit, and they're struggling to retain talent and build talent. So I think for a lot of organizations that are not direct service provision, this is a huge opportunity to realize, like, yeah, you can have a worker in the, up in Sudbury or, in Thunder Bay, and it makes very little difference. And you can have them effectively contribute. And for a lot of organizations, I think that strategy of, okay, we may not be able to pay people enough to, thrive in Toronto. How do we enable them to succeed as a new staff person in, any community across the country when they're hiring?
Yeah. All right. That was a nice optimistic twist on what had been pretty doom and gloomy. I'm curious, though, is there a part of the nonprofit sector that has been the most affected by the pandemic?
Yeah, and there's a number of different lenses we could look at. And I would say, let's say 4 groups that have been particularly impacted. Small grassroots organizations are definitely one. Arts and culture organizations, particularly ones that rely on fees, obviously another. And sports and other organizations where people are just not participating at all, and again, typically relying on fees, is yet another area of profound challenges. And then, just looking at the sort of demand versus revenue cycle, I think the food insecurity piece is one we already talked about. But that combination of declining revenue with just utterly unprecedented increase in demand is such a interesting situation of what's. And I mean, more broadly, a lot of the common themes of organizations that have been hit hard are ones that rely very much on in-person revenue streams. And obviously, everyone's been hit hard when they rely on in-person service delivery, but you can usually pivot sort of in some way, some of the online service delivery a bit easier than if you're a YMCA selling a health and fitness membership pass, it's not quite the same trying to, you can't use a treadmill, you can't use the facilities. If you're a theater, the challenges of pivoting to let's do an online stream of a theater thing, it's not an easy pivot. And so a lot of them, who relied on that revenue stream, or the heavy, in-person fundraisers as another example, any of those sorts of organizations, that's how you fund yourself. Those are all going to be hit hard.
Yeah, absolutely. The other thing I'm curious about with the nonprofit sector is, there was this conversation about racial justice that really happened over the summer and is still ongoing. And I'm wondering if you could talk about how that conversation has gone in Toronto.
Yeah. And I think like a lot of the things that we talked about in our report were highlighting the challenges, and we interviewed dozens of BIPOC leaders about the issue. And I mean, there was definitely a mixed sense of like some people optimistic of how much attention it was getting, and maybe hoping that this would actually be the trigger for real change. And there's so much attention, and there's other folks who had been around a few cycles of this, who were very worried that like this would be a temporary thing, a bunch of money would flow now, and then it would disappear. So, I mean, when we talked to Manuel Mellis of the Network for Advancement of Black Communities, I might be getting that name wrong. Like, so he talked about how he'd been in this field for almost 30 years, and he'd seen these cycles of suddenly a ton of money flowing to like programs for Black youth, and then like 3 or 4 years later, the money's gone. The organizations that were started to respond to it start to wither away. And I think one of the quotes we had in the report was people talking about how like more than 100 organizations were created after the summer of the gun in 2005 in Toronto, which when there was a whole bunch of shootings and a whole bunch of money was invested in Black youth, and like less than 5 or 6 organizations might be still around from that. And there's this huge investment, but because there wasn't that sustained strategy for how are we going to keep these organizations around, thriving, and doing everything they can need to succeed, there's a real challenge. And I think there was definitely that side even of those folks who'd seen this before, who thought this might be the moment to do things completely differently, and that maybe we've learned from the mistakes. Maybe, the sustained attention will mean that like funders, governments, philanthropists will realize like you can't just go in for a short period of time and then go on and find the new shiny thing. But, if you want, to change how like issues are in Black youth unemployment, you can't fund, something for a year and then walk away. Like, this is going to be a decades-long challenge to continue to make those inequalities less.
Yeah. So I suppose that's maybe a lesson for any philanthropic organizations listening, is to provide sustained attention to this issue for sure.
And one of the things I would say for anyone who is like who has the capacity to provide resources and funding is, like, the more you can signal for long-term commitment, the more organizations can plan and build the infrastructure in place to actually be able to, really and truly address these sorts of situations. And I think like there's increased attention and understanding that no single organization can fix a systemic problem. And so if you want to fix these problems, like organizations need to know like the funding and resources are going to be there for a long period of time if they're going to be building these multi-year partnerships where they understand what each of their roles might be and, looking at different aspects of the problem.
Yeah, so whether you're a big funder or an individual donor, that long-run commitment is great. So smaller donors, monthly donations are great. I always want to plug that. So I know there was so much detail in this report, and we haven't captured all of it in this discussion. So I just want to ask if there's anything that we missed talking about that you really think we should talk about.
Yeah, one of the things I think, there's quite a few points in this conversation that we focus on some of the negativity. I also do want to highlight, when we talk to all these individuals working in the nonprofit sector, they're incredibly impressive. And it was a great opportunity for me to be able to hear so many of their stories. And I think some of how they've responded, immediately and in a sustained manner to the challenges is just, I think humbling. And I really think, it does speak to, for folks who are wondering, what's going to happen next. We need to support these leaders because they're incredibly impressive, smart, intelligent people who are giving everything they possibly can. And, almost every single one of the organizations we spoke to, you end up the conversation being like, well, that person's incredibly intelligent, and I wish I could fund them as well. And I think if I would encourage anyone to go through this, find anyone we interviewed and quoted and go donate to their organization, because they're incredibly impressive. And, if we're going to come out of this stronger, more resilient, and more equitable than ever before, I do think these leaders are going to play a major role in that.
Great. Yeah, that's a good optimistic note to end on. So I love it.
Yeah, I just try to throw my optimism in for 30 seconds at the end.
Well, that's okay. People just have to listen all the way through to get the positivity. No, I think you said a lot of really positive things throughout this whole thing. This report must have been, I know you were saying that you were so impressed with the leaders that you spoke to. And, you know, these organizations are doing really incredible work, and the resiliency that they're showing in this really difficult time is absolutely incredible. But I feel like this report must have been so depressing to write. Like really exhausting, and then you had a baby coming at the same time. Like,
yeah, I wouldn't recommend it to be writing anything like this to anyone, to be honest, but I do hope that folks are using it. And I mean, we tried to outline as much as possible what could be done to make a stronger and better recovery. So we've had quite a bit of like so many downloads, lots of coverage and all that sort of stuff. So I do really hope we're able to make a real contribution. I do sort of miss some of the research I used to do, or work that I used to do, where you know, you're just trying to, like, how do you market something more effectively, or how do you price something to make more money? It's sometimes a bit easier than
fix the pandemic.
Yeah.
Yeah, the emotional labor that had to go into this report, I can't even imagine. So thank you for the work that you've done on that, and for taking the time to speak to us today.
Yeah, thank you so much for having me. It's always interesting to hear, again, with 100 and some pages. So it's really interesting to see, like, someone who read through it, see what questions she came up with it. And I would really want to highlight, like, this report was completely made possible by the support of Toronto Foundation. I was the lead researcher and author of it, but you know, they recognize as part of their strategy of how they're going to respond to this pandemic that this sort of intelligence is critical. You can see, if you look at a lot of their funding programs, you can see how it influenced the types of programs they're running, the organizations they're prioritizing, the way they're going about you know, working with philanthropists, and all these sorts of things. And I do think it was a very unique research product in Canada. And, you know, I think a lot of folks have done various pieces of this. And I do think that, like, the work they did of trying to recognize that this information needed to be there, even relatively early on, to help shape recovery, is, I mean, it was a great opportunity to be able to pull all of this together. And I know, from a writing standpoint, trying to find data sources that didn't exist is not the most fun sort of thing, because on top of everything else, like, you know, in the middle of the pandemic, like, none of the data sources we typically rely on to write this sort of thing, like, you know, none of them are just trying to, like, generally pick up these sorts of profound changes month to month. So we had to be very creative and identify new different data sources that would allow us to see how things were changing in a very quick basis. And part of that was getting so much data from nonprofits who shared, like, operational data. And I would say one thing that this sort of piece hopefully will highlight to folks who are working in the nonprofit sector is, like, you know, when you think about what your data can be used for, like, it can be helped to understand systems. It sometimes can be used to help influence advocacy. You know, there's a lot of different things when you think of, like, information you may have. And a lot of times folks are, like, especially if things aren't going well, they may not necessarily be thinking, oh, I should share this widely. But folks, you know, who put that stuff out there, who shared that with us, I mean, I think a lot of the pieces that we wrote got picked up in, you know, different media outlets by different public policy folks and stuff like that. And I think sometimes people don't realize how valuable their data could be. And, you know, some folks may not necessarily have the talent or skills or, you know, resources to be able to do that. But those who did share with us, you know, I think it is a really interesting example of how you can do more with information that may not necessarily be obviously how others would use it.
Awesome. That's really cool. Thank you for taking the time to speak to us. And I think your dog is ready to go for a walk. So
I told you he'd show up at some point.
Is it a Zoom call without a dog? I don't think so. So I think at this point we'll say goodbye to you, Steve. Thank you so much for taking the time to stop by today.
Thank you so much.